Let's start with the big story that we are tracking on WION this hour, where the UK COVID variant is travelling faster than expected. The proven to be about 56% more transmissible, the strain has now showed up in more than a dozen nations. Enough, France has reported 2 active clusters and at least about 19 confirmed cases of the mutant strain.
Pour éviter à tout prix la diffusion de ce variant en France. À ce jour, nous avons identifié 19 cas en circulation sur le territoire national, dont 2 dans le cadre de clusters dits à risque, un en Ile-de-France et un en Bretagne. Nous nous attendons clairement à en identifier davantage.
Now, there is one thing that needs to be noted here, that people who tested positive in a care home near Rennes, none of them had a recent travel history to the United Kingdom. And the French ministry has confirmed the presence of the mutant strain in patients, but has said that detailed reports are expected next week. The story is pretty much the same in another place called Bagnov. A person working in 2 different schools tested positive for the mutant strain of the virus, but has no recent travel history or even contact with anyone who had recently visited Britain. And the situation is pretty concerning. Health authorities have said that the mutant virus is already circulating in France. In the wake of the rising cases and also the presence of the more transmissible strain, France has decided to close off its borders with Britain. The French Prime Minister Jean Castex made the announcement on Thursday.
Nous avons décidé le 20 décembre dernier de fermer les frontières avec le Royaume-Uni et cette mesure sera prolongée jusqu'à nouvel ordre. Seules certaines catégories de personnes très précises sont autorisées. Elles doivent obligatoirement présenter un test négatif réalisé sur le territoire britannique pour entrer sur notre territoire.
France is making sure that all protocols are in place and that the summer of 2020 does not repeat itself again. And to ensure that, the French health minister has said that not just Britain, but those travelling from South Africa to France also need to present a COVID-19 negative test report.
Personne venant de Grande-Bretagne, mais également d'Afrique du Sud, doit présenter le résultat d'un test négatif datant de moins de 72 heures avant le départ s'il souhaite venir en France. Nous prenons la menace de ce variant anglais et la menace de ce variant sud-africain très au sérieux et nous prendrons toutes les mesures qui s'imposeront si ces variants devaient s'avérer diffusés sur le territoire national.
The officials say the testing will be intensified in France, especially the clusters, and that people reporting the mutant strain will be kept under strict isolation. All right, now to give us more perspective in terms of how this new strain of the COVID-19 infection actually spreads, we're joined in by Dr. Julian Tang, an honorary associate professor and also a clinical virologist at the University of Leicester. Now, Doctor, let me begin by asking you this. This is a new mutant strain of coronavirus. Now, a lot of countries tried to stop it by stopping travel between and to Britain, but that clearly seems not to be working.
Yeah, so once you see 1 or 2 cases or more in a particular country, you know, there's an iceberg effect, so there'll probably be like 5 to 10 cases already there. And these 2 large clusters in France already demonstrate that this virus is now endemic in that population, and closing borders probably won't help very much. It may slow it down, but they've already got cases in the country that are already spreading amongst the population with no travel history.
Now, my question to you is, France is, adjacent to Britain, separated by the English Channel, and it has now decided to close off travel, restrict travel at least with Britain. But does that now help France in ensuring that what happened in the summer of last year does not repeat itself this year with the new mutant strain of the virus?
Well, closing the borders may slow down the importation of new cases of this variant, but they may have enough cases already in the country, spreading amongst its citizens already, to actually fuel another local epidemic of this new strain, which is what we're seeing. The 2 large clusters suggest that the virus is already embedded in that population.
Dr. Tang, and what more do we know about this new mutant strain of the coronavirus? Does it, we know for a fact that it is more transmissible, 50 to 70% more transmissible, but in terms of the impact on health, is it very different from the earlier strain of the coronavirus?
So we're not seeing a different pattern of symptoms just yet, but of course it's still early days, and we're not seeing a change that's drastic enough to reduce the effectiveness of the vaccines. However, if you have more cases will have inevitably more hospitalizations, and they will have more deaths, and they may overwhelm the healthcare service, which is what we see in the UK at the moment. So it's just an overall higher burden of cases that we're seeing with this more transmissible strain that is the current problem here.
And also what has been noticed is that more children seem to be contracting this new mutant strain of the virus. Do different nations around the world change their policy of reopening their schools?
Exactly. So it may be because we're looking more at children than we were, 6 months to a year ago. But now we know that children can actually get infected, they can transmit, even though they stay very, relatively well and asymptomatic. And we know now that children, just like other respiratory viruses, like influenza, RSV, they are vectors of the virus. But in this situation, with this virus, they are much less symptomatic, because children do get symptoms with flu, they do get symptoms with RSV, etc. But this virus is a bit more deceptive. It doesn't show symptoms in children, but they are getting infected and they are transmitting the virus. But we just haven't been looking at this very closely until now.
All right, we'll have to leave it there. Thank you very much indeed, Dr. Tang, for joining us and getting us all those insights then.